Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory, and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair like bald patchy hair. And however, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided and can be fixed by modifying to managing our faulty lifestyle. Today, we have with us Dr. Pallavi Ailawadi, is a well-known doctor who specializes in dermatology. She's MD in Skin and VD from Delhi. She has done her MRCP too from London, UK. She is currently working as a consultant dermatologist at Delhi and Faridabad and as faculty for MBBS doctor all over the country. Dr. Pallavi has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to her patient. She takes time to listen to her patient and work with them to develop a treatment plan that meets their individual requirement. Dr. Pallavi is aware of the need for the patient awareness and education about hair care and hence spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Pallavi, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Hello, thank you for having me here.
थैंक यू डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया सो डॉक्टर टुडे वी आर गोइंग टू डिस्कस द हेयर केयर इन करंट सिनेरियो सो व्हेनेवर वी टॉक अबाउट हेयर केयर द फर्स्ट एंड द foremost questions and the problem which is faced by all of us is the hair loss irrespective of age and gender. So is hair fall normal?
I would say hair fall is completely normal because the hair generally moves in a cycle. The hair that has come, it will grow long and it will fall. And in the same place, a new hair is going to come. So this is a cycle. We call it as the hair cycle. And that makes hair fall completely normal. I would say for somebody who has a normal density of hair, about 100 hair falling a day is normal. So you should not get alarmed if you see some hair coming in your comb or while shampooing, because up to 100 hair a day is normal if it falls. For people who have slightly lesser hair density, who have thinner hair, for them close to 70 to 80 hair a day is normal, I would say.
So, Doctor, now that you have said that hair fall is a normal thing, so can you just enlighten us, like when to be, like what's the alarm sign, and when should we concern for, and when should we visit to the doctor?
See, as I told you, up to 100 hair a day is normal. So, if you see more than 100 hair fall a day, now nobody counts hair, right? Though I do get a few patients who get so scared that they do count, but normally when you see a bigger bunch, when you see a change at the rate in which your hair is falling. So there are months and days when your hair fall is normal, but now suddenly for the last few days or weeks, you notice a bigger bunch of hair in your comb. Or maybe you're waking up, you see hair falling on your pillow at different places in your house. So while shampooing, you see a big bunch of hair falling off. So that are the times when you have to get alarmed. It is a rate change. It's like a change that you notice. The routine hair fall, what you have every day, you already know what you're having. But when you see that there is an increase, that is when you have to be alarmed. And for people who have thinner hair, so they wouldn't be losing 100 hair a day. As I said, they would be losing close to 70, 80 hair a day. For them also, a change in pattern. You notice thinning on your scalp. You see that your hair is thinning. Girls and ladies who make ponytails and buns, if they notice that their ponytails are getting thinner, their bun is getting less bulky. So, that is when you see that you are having a noticeable hair loss, and that is when you have to be alarmed.
Okay, doctor. Very interesting, very informative. Doctor, now that we know what's the alarm sign, the another question which come up to our mind is like, what are the causes of hair loss? Why do we get hair fall or hair loss?
See, there are multiple causes of hair loss. If I go into dermatology, theoretically, there are multiple causes of hair loss. But the most important cause that is relevant, especially for the younger generation, I would say, is the genetics. It is the hereditary. If somebody in your family, whether it be on your father or your father's side or your mother's side, it could be your mama, your nana, your chacha, taya, anybody in your family, the first tier family, if they suffer from a premature thinning of hair, if they have had a premature hair loss, then you have a higher chance of that hair loss. And secondly, I would say hormonal causes, especially in the girls. PCOS and certain other hormonal issues are a very important cause of hair loss. And I will make it a point here to the boys also who are watching it, that these hormonal issues are not just in girls. Many a times, even boys have underlying hormonal issues, especially if there is a component of obesity, excessive weight, a family history of hormonal issues in the mother. So even the boys tend to have these hormonal issues. So first would be you have a genetic tendency. Second, if you have an hormonal issue, and the most prevalent thing in our lifestyle these days, that is stress. Stress on its own, whether it be your academic stress or it be an emotional stress, that also becomes a very important cause of hair loss. In fact, if you notice, when you've had a very stressful phase in your life, you notice excessive hair loss after that. So your lifestyle, which includes stress, then these days a lot of teenagers are into smoking, alcohol, drug use. So all of these also contribute to hair loss. And then some of the patients may be on some medicines. If you're taking certain medications, that may cause hair loss. So there are multiple reasons, but these are the most important ones. And then some times nutritional deficiencies, even though the kids and the teenagers these days take good care of their health, they're very, very focused on maintaining good nutrition, good health, but still some nutritional deficiencies do creep in and they can also cause hair loss.
Okay, doctor. So like nowadays we all are having like a very poor and very, sedentary lifestyle. And also like we are working from home. So like we sleep late, we work late night, and we don't have like good eating habit, and we eat anything. So can a person lifestyle also play a role in hair fall?
Absolutely. On the third number, I said lifestyle. Now, lifestyle is like a big blanket of causes. It is not one thing which makes your lifestyle. Your sleep cycle, your nutrition, your stress levels, smoking, alcohol, then the amount of phone, how much you stay out in sun, what is your exposure to dust, pollution, everything is a part of your lifestyle. So when I ask my patients of hair fall, all of these individual topics I touch when I get a patient of hair fall, because all of these contribute excessively to the hair fall. Genetics, I can't change. Hormonal issues, I can correct. But the biggest thing that can be corrected is the lifestyle, because that is also the biggest correctable cause in the patients. So if you don't sleep, you don't have a regular sleep cycle. Some people sleep late, get up late, but they have a regular cycle. Some people have night shifts, but they have a regular cycle. So as long as your sleep is normal, it is regular, it's fine. But if you don't have a regular sleep cycle, it creates stress in the body. It increases the levels of stress hormones, and that does cause hair loss. So, not sleeping properly is equal to being stressed. If you look at it biochemically, what happens within the body, that is equal to stress. So even though you may not be emotionally stressed, but your body is stressed. So that is going to cause hair fall.
Okay, doctor. So, doctor, very informative. So, doctor, now that we know the hair fall, why hair fall happens, and we all are having hair loss problems. So, can you please enlighten us today? Like, what are the medical treatment options available for hair fall, like topical or surgical or non-surgical, or is there any oral also which we can eat and manage our hair loss problems?
See, there are, thanks to science and thanks to the dermatologists out there who are into research and development, we have multiple options these days for hair fall. But I'll say the first part that I and most of our fraternity does is, first of all, when a patient comes to us, we find out the cause of the hair fall, because it is the most important to know why you are having hair fall. So first thing that we do is we find out the cause of the hair fall. We ask certain questions, we get certain blood tests done. And once we find the cause of hair fall, then we come to the treatments. We have topical lotions, we have oral tablets, we have multiple modalities like platelet-rich plasma therapy, microneedling, GFCU, which is like a stem cell therapy. Then we have laser helmets, mesotherapy. There are multiple, there is like a vast plethora of treatments that we have for hair fall. But first and most important is to find the cause of the hair fall. So yes, all you hair loss patients out there, don't be worried. We do have all the treatments possible. Yes.
Okay, so according to the root cause, we have varieties of treatment which we can. Okay, doctor. So there's, doctor, one word called nutraceutical is getting a lot of focus nowadays. So what is nutraceutical and what is the role of nutraceuticals in hair health?
See, nutraceuticals is two words which are joined together. Nutra means nutrition, means it is the molecules that give nutrition to the body. And ceutical in itself means medicines. So when you use nutraceuticals, it means you're using nutrition as a medicine. Now, we've been born and brought up with hearing all of this around us from everybody in the family and the, seniors, that you have to eat good food if you need good skin and you need good hair, right? So nutrition, we've been hearing since our childhood all around that good food and good nutrition gets us good hair. So it is very important now. If somebody is deficient, if somebody has below normal levels of certain important chemicals, then if we substitute them, we supplement them, it brings about a good benefit in the hair loss. So, these are important only when you are deficient in these. Yes.
Okay. So if any deficiencies there, we can take nutraceuticals to compensate those deficiencies.
Yes.
So, then what are like vitamins and minerals? Are they required to take for the management of alopecia or hair loss? Like, what are some of the vitamins or minerals for the management of alopecia?
See, vitamins and minerals are, I would say, the building blocks of the hair. They are in fact the building blocks of the entire body. And in the hair also, they are very important because hair takes all its nutrition only when it is in the root. So the nutrition from the root goes most important in making your hair healthy. So yes, taking a well-balanced diet, then if there are any deficiencies, supplementing them, taking tablets as prescribed by your doctor, all of this plays a very important role in treating your hair loss. And the important vitamins, I would say, all vitamins are important for hair, but the most important is biotin. Okay. And then we have some trace minerals and what we call them as micronutrients, they become important. So the most important micronutrient in the Indian setting is iron, because close to 60 to 70% of the Indians are iron deficient. Means there is some deficiency of iron, and iron forms your hemoglobin. Hemoglobin takes oxygen and power to the hair. So if you have less iron, you get less power to your hair. So I would say that is a very important micronutrient which we have to substitute. Apart from that, there is zinc, there's copper, there's manganese. There are multiple other micronutrients which build the hair.
Okay, doctor, very informative. So, doctor, is it required to take these nutrients as per gender RDA requirement, or we can take it like blindly?
Blindly, never. Please, I would suggest never to just go somewhere and buy vitamin supplements or buy those gummies which are available online. No, never do that, because they are not medicines. They are over-the-counter products. That is why they can be sold the way they are sold. So do not just follow any social media account and buy biotin gummies or some supplements from random places. Do not do that. Always visit your doctor. The doctor will get your levels checked and then prescribe you specific tablets, because even though not very different in the men and the women, but to some extent the men and the women are physically different. The body weight, the body structure, the physical requirements, and the nutritional requirements are different in the men and the women. So if you go to the RDA charts, which are the recommended dietary allowance, the RDA charts are recommending a different type of supplementation for men and different levels for the women. So yes, to an extent, these requirements are different. Then they depend upon your lifestyle, whether you have a sedentary or a moderately active or a very active lifestyle. So your dietary requirements differ as per your lifestyle, your gender, your weight, your height. So the doctor decides that as per the individual patient and prescribes them those medicines. So in short, for your question, yes, the requirements do vary across the gender.
Okay, doctor, interesting to know. So, doctor, like earlier also, you have mentioned that stress is important for hair health. So, doctor, like, can you also enlighten us a little more about like how this stress is important for hair health, or how does it impact our hair health?
See, being stressed, there is something called as physical stress. There is something called as emotional stress. So physical stress is if you have a very rigorous work requirements, or you're a sports person, you're an athlete. So all of that is a physical stress to the body. Then if you are somebody who has emotional stress, you stay stressed, you have work problems, or you have a personal issue, or you're just somebody who takes more stress. There are people who just take more stress. So either way, when you are more stressed, your body creates more of a hormone which is called as cortisol, which we call as the stress hormone. And that hormone reduces the blood supply to the hair. That hormone shortens your hair cycle. So first, when it reduces the blood supply, your hair becomes weaker. Then it shortens your hair cycle, they fall off early. So in total, when you are stressed, the stress hormones are increased, you have more hair fall. Then some people do stress eating, they gain weight. Fat has the ability to make those hormones, which again lead to hair loss. So stress actually makes the hair much, much weak. And that is a very important preventable cause of hair loss.
Okay, doctor. So, like, doctor, when we are stressed at home, and our mothers say that oil ka massage kar lo and अच्छे से oil लगा लो, relax हो जाओगे, stress गायब हो जाएगा और बाल भी बहुत लंबे और घने और सुंदर हो जाएंगे. So, what do you suggest? Like, oiling hair is a boon or a bad?
What do I tell you? On every prescription of mine, if a patient comes to me, I write in big letters, no hair oil. So as a dermatologist, I do not ever say that hair is going to improve your, oil is going to improve your hair loss. Yes, I tell my patients, if you want to do oiling, you can maybe apply oil a night before you shampoo, or maybe a few hours before your shampoo. So that much oiling is okay. And while you apply oil, don't do a lot of vigorous rubbing on the scalp. Because when you do a lot of vigorous chumpy, which is called as chumpy, that makes the hair weak and you notice more hair fall after the chumpy. And then there are some organisms, some fungi which live in the scalp, they feed oil. So excessive oiling can also lead to dandruff, which on its own can also contribute to hair loss. So in total, I do not recommend hair oiling, though it may relax you, but then you should wash off your hair after 2 hours. Don't let the oil stay. Yes. So you relax, you reduce your stress, but then you wash it off.
So oiling is just for relaxation, not for promoting hair growth or something. So doctor, can you give us some important tips for healthy hair today?
Important tips would be, first and foremost, nutrition. Do not just eat junk food or oily food, not because oil causes hair damage, but because when you focus more on these junk foods and oily foods, you tend to eat more outside. The nutritional balance of that food is, skewed. It does not give you what you want. So take care of your diet, balance your food well. It should have green leafies. I tell my patients you should have at least 2 different vegetables and 2 different fruits a day in your diet. Then the diet is supposed to be high protein. I absolutely do not recommend protein powders, but you increase natural protein in your diet. So if you're vegetarian, eat more of protein-rich vegetables and pulses. If you're a non-vegetarian, you can increase chicken, etc. in your diet, but take more of natural proteins. So first and foremost is your diet. Second is your lifestyle management. If you can quit smoking and alcohol, good. Otherwise, take care of being in moderation. Secondly, smoking is actually, I'll tell you, the leading cause of hair loss in a lot of patients, because when you smoke, it constricts your blood vessels, it makes them tiny, it makes them narrow, and it does not let oxygen reach your hair. So smoking is not just injurious to overall health, it is very injurious to your hair. And then, so you manage your lifestyle, you manage your stress, and you have a regular sleep cycle. Be happy, be healthy. If you exercise, you increase the blood flowing in your body. So when the blood flows in the body, your blood also goes to your hair. So exercising actually improves the hair fall a lot.
Okay, doctor. So, doctor, one last question is that we all actually hair problem is something which we most of the people don't know whom to concern for. So today, can you enlighten us like whom to consult for hair problems?
See, in India, dermatology awareness is picking up. So yes, a lot of people these days know that dermatologists are the doctors who take care of hair. So if you all know good enough, if you have to tell to your friends or your neighbors, please always tell that it is dermatologists who are doctors of skin, hair, and nail. So hair problems should always go to dermatologist. Do not refer to some social media blogs, or do not refer to your friends and neighborhood doctors, as we call them, for advice. Because do not take anything, any tablets which are not prescribed by your doctor. So always visit a doctor, let them find out why you have a hair loss, and then you let them treat it.
Okay, doctor. This discussion was very informative. I'm sure our viewers would be benefited by it. So, doctor, can we take some live questions from our audience?
Of course, yes.
Okay, the first question from our live audience is, Doctor, are the home remedies like lemon juice and onion juices can actually prevent hair fall? And also there are a number of products available online. Are they really useful for hair fall?
See, onion juice and garlic juice, all these I have seen patients use since eternity. Some patients benefit, some patients don't benefit. So scientifically also, there have been a lot of studies done. They do say that sometimes this onion and garlic juice can improve hair fall. So I am not going to completely disregard it, but then as a note of caution, I will also say that I have seen many more patients burning their skin by using onion juice. Very honestly, I'll tell you, I've seen so many patients who react to this onion juice and garlic juice, and they come to me with proper burns on their scalp. So, do not concentrate it much, use it one-off times, but it should not be something that you do very often because it can also burn your skin. Okay, I have seen many more patients of burning the skin than actually benefiting from it.
Okay, doctor. Another question from my live audience is, Doctor, my daughter is 12 years old and she goes to school, and I see some gray hairs are coming in her head. Is it because of heredity or something is wrong with her? Why she's getting gray hair at a younger age?
That's a good question because I think a lot of people will benefit from this. I get a lot of patients where children as young as 10 years, 12 years are getting graying of hair. See, 2-3 gray hair are normal. It is not a cause of concern if the child has only a few gray hair. But yes, if there are more gray hair, the two most important causes are number one, hereditary. So check in your family if the mother, father, or their parents, anybody has a history of premature graying of hair. And I wouldn't say that they had to have gray hair by 10 years. If somebody in your family started having graying by the age of 25, 30, then the child can have it by 12 or 13. So there has to be a family history of premature graying. Secondly, if there is family history of thyroid or any other such issue, then in those patients and their children, there could be premature graying. And thirdly, micronutrient deficiencies. So zinc deficiency, B12 deficiency, especially in vegetarians. You know, there are certain deficiencies in vegetarians and in children who don't eat well that can also lead to graying. So I would say if your daughter has excessive graying, visit a dermatologist, let them get the blood test done because deficiencies is the only thing that we can treat. And that's a treatable cause. So if the doctor finds out that there are any micronutrient deficiencies, then definitely your child will have a good result.
Oh, doctor, so these premature gray hair can be controlled or stopped?
Yes, if there are deficiencies, definitely yes.
I quickly take a last question from our audience because we are running out of time. So I think every female wants to know, Doctor, I want to know that two questions. I want to know that hair, the heat treatment for the hair is okay or not? And also, can you give some tips for getting a clear skin like you?
Clear skin is all genetics. To be very honest, it's all genetics. Everything in skin and hair is genetics. To be very honest. So you look at your parents' skin, that is the kind of skin you are going to have. Thirdly, no, that's very honestly, everything is all about genes in the entire body, in the skin and the hair also. Very, very important is genetics. And above that is your lifestyle. So these are two things. If you take care of your lifestyle, your skin, hair, and nail is going to be good. exercise, eat well. What was the other question? Heat treatments. Heat treatments, I would never recommend. I would never recommend. You know why? Because hair falls in two ways. One is your hair falls out of root. Two, the hair breaks in between. Either way, it is going to form a part of your bunch, which you see after combing. So you would not know which hair is coming out of root and which hair is breaking. So whenever you subject your hair to excessive chemicals in the form of smoothening, keratin, or heat treatments, it does weaken your hair. So it does weaken your hair. It can cause hair loss, and many a times they don't take care of staying away from the roots. You know, a little less experienced hairstylist or somebody who is just in a hurry may end up touching your roots with those chemicals. So that can also weaken the root, and then your hair can also break from in between. So I wouldn't recommend, because if you go into the science of keratin and smoothening and all these, the chemicals that they use are actually breaking the bonds of your hair. They are weakening the bonds of your hair so that the hair becomes limp. It becomes straight. So the science behind using those chemicals is to weaken your hair. So how can it be good for the hair? And as a dermatologist, my opinion would be a little biased, because most of the times I see people who get hair loss because of these treatments, right? People who don't get hair loss don't come to us. We only get those who get hair loss because of these treatments. So my opinion would be a little biased, but I would never recommend to subject your hair to such harsh treatments. These are actually very harsh on your hair. Even repeated heat styling at home, using heating iron and using all of that. Use a heat protectant spray so that it does not damage your hair, and keep the styling as limited as possible. It should not be a part of your daily routine.
Okay, doctor. So, doctor, would you like to give a take-home message or any other suggestion to our viewers today?
See, hair is the most important part of your appearance. I would say we take good care of our skin, and we take good care of hair. That actually becomes a very, that is, as per our dermatology textbooks also, in the functions of hair, the most important function of hair is improving the cosmetic outcome. It is like the crown of your body. So taking good care of that is very important for your self-confidence, for your happiness. So just eat right, eat well. Do not follow some social media marketing gimmicks or some random advices and start using things, eating or applying, which may end up harming your hair. Okay? So be very cautious. These days, it is very easy to get influenced by the influencers online and start doing things that may not be so good for your body, because it's not personalized. These are just general suggestions that are being given out there. They may or may not suit you. So please do not blindly follow social media gimmicks. Be cautious, be aware of your body's requirements. If ever you feel alarmed or you notice a change in your hair loss patterns, make it a point to visit your nearest dermatologist. That's all I will say.
Thank you, doctor. Thank you for sharing so much of information and all your expertise with us today and answering all the questions of our viewers today. I'm sure our viewers have found the session very helpful. Thank you, doctor. It was a delight to have
Thank
you.
you.
And thank you for your time.
Thank you so much. Okay.
Thank
bye.
you, ladies and gentlemen, for joining us today. This is Mona Sharma signing off for today. Thank you, doctor. Bye-bye.